Hey everyone, it's Sarah with RegisteredNurseRN.com, and today I'm going to talk about one particular nursing interview question that you don't want to get stumped on while you're being interviewed. Many of you have recently passed your boards and now you'll be studying for your very first nursing interview. Now I have a video that discusses some of the top nursing interview questions that you definitely want to check out before you go to the interview, but here in this video I want to talk about one particular nursing interview question that you want to be prepared for so you don't get stumped. So what is the one type of question that nurse managers are asking their interviewees? Well, many of them are asking about the nursing care related to the specific specialty for which they're applying. For example, let's say that you are interviewing on a cardiac unit. Well, that nurse manager is probably going to ask you a question about how to deal with a patient who is having chest pain. What are you going to do for them as the nurse? Because I can tell you from working on a cardiac unit, you're probably going to have a patient at least once during your shift complain of chest pain. It's very common. Now, as a new grad, you don't have a lot of experience. So you need to make sure you know exactly what type of unit you're interviewing for, because this will allow you to go back and refresh your knowledge of that particular area of nursing prior to the interview. So let me give you some examples on how to prepare. Let's say you are interviewing for that cardiac unit. First, what you want to do is you want to review some common cardiac diseases, such as heart failure. That's a really big one, along with myocardial infarctions, coronary artery disease, hypertension, heart valve disease, and be able to recognize basic dysrhythmias on an EKG. Also, you'll want to be prepared to answer questions that deal with pre- and post-op care of the cardiac patient, because many of these patients will have a heart cath, a stress test, and some will even get a pacemaker placed. So you'll just want to know the basic nursing care that you learned in school about these procedures. Also, you want to be familiar with common tests that are ordered for the cardiac patient, like cardiac enzymes. Also, those common cardiac medications used to treat those diseases, and basic nursing interventions that you'll be doing for that patient. Let's say they have heart failure. Big thing we want to watch out for as a nurse is the patient going into fluid volume overload. So you'd want to intervene with your nursing care with strict I's and O's, daily weights, and making sure that they're following a low sodium, low fat diet. So those are just some things that you want to prepare for prior to going into that cardiac unit interview. Now, not all nurse managers are going to ask this particular question, but if they do, you will be prepared for it, because I have spoken with some recent nurse graduates and they said that this question had come up. Now, what if you're asked a question like this, but you go blank and you don't know what to say? Well, instead of saying, I'm not sure, I don't know, try to buy yourself some time and have the nurse manager elaborate a little bit more on the question or the scenario of whatever they're asking. Or you can start out talking about some areas of cardiac nursing that you're familiar with and then shift to that you would consult with a fellow nurse. Because sometimes it's not about your answer to the question, it's the way you respond. That's really sometimes what most managers are looking at. They're seeing how well you present under pressure, can you think quick on your feet, and what you would do when you don't know something. Okay, so I hope that helps you with your nursing job interview. Now, if any of you have recently went to an interview, please feel free to share any of the tough questions you received in the comment section below. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.